Hey everybody. This is the first time I've ever done this. I don't know if anybody's going to join, but in order to not make this incredibly boring, I decided to answer a lot of the YouTube comments. Some of these questions may be very helpful for other people. So we'll just take it from there. All right. So, first comment here, I had a video, number one mistake a dentist will make when placing your dental implants. I just have my screen over here. Actually, I'll just leave it right here so I can read right from here. Um, I am a GP dentist. I place hundreds of implants every year. I use guided technology. That's great. And so placement is never a problem. Use Straumann implants. That's great. Those are great implants. Restore my implants by myself. And so accurate well implant placement is a must. Not sure why there's an assumption that implants placed by GPs are always the problem. And I never said that. Implants placed by GPs. I've worked with many different GPs over my 12-year career. I used to be a contract surgeon working all over DFW, and I've worked with many great dentists. So, and I have friends, many people who place their own implants, and they do a phenomenal job. So I never did say that. But anyways, in my practice, I see on monthly basis implants placed by oral surgeons and periodontists that are a complete failure. And when I asked the patient, they reported that not even a CBCT was taken. That's the 3D scan was taken prior. And most of the times the implants are placed in 30 minutes because the specialist needs to move on to the next patient. If you're placing dental implants without a CBCT, I think that's a huge no-no. We always use CBCT. You want to look at the bone dimensions. I'm actually creating, I've been working on something for like the last month. I've been creating these series of videos that I really want to help educate the people, because I've noticed that when I've been lecturing about some of this stuff, it's just like I'm just kind of talking about what I'm encountering. And dental implants is a very wide encompassing field. So I've been working a long time on this. So I'll probably start filming it in about a week or so. So, oh wow, getting some questions here already. How is the tooth filling process? I haven't filled a tooth since 2008 in dental school, so I'll leave that to another dentist to answer for you. I have gum that has receded and need a crown, but dentist said he won't do. Can I have gum laser surgery to correct? Okay, so you don't do gum laser surgery for like recession. Gum laser surgery is for periodontal disease. That's when you have deep pockets due to bacteria that is causing your gums to be inflamed. And when your gums become inflamed, they start loosening from your tooth and your roots. And because of that, that allows bacteria to go deeper and then cause more gum loosening and pocketing and also bone loss. So that's what the laser is for. For recession, the only way you can treat that is with um, connective tissue grafting, free gingival grafting. That's how you treat it. But you have to get that treated before you do a crown. Don't ever do a crown and then do the recession later on. So that's a very critical point to bring up with your dentist. What is the true cost of a zirconia upper and bottom if I already have implants? So I'm thinking that you're talking about a zirconia prosthesis, a full set of teeth, like this. That really depends on many factors. It's like, number one, I'm going to sit there and say, what part of the country are you at? If somebody comes to me and they want just a zirconia prosthesis, I'm not building that on top of and we have our prosthodontist here, but he's not going to build those teeth on top of your implants if they don't have very good spread, and they also have no bone loss. Because for liability purposes, we don't want to be in trouble for building something that the implant then fails on, where the implants placed with enough bone dimensions around it to ensure its long-term survival. So those are certain things that we want to make sure of. I have a failed root canal in my front tooth, which I'm getting extracted next week. Oh wait, so let me. Sorry, a little ADD. In regards to like answering a question for the zirconia, so again, what I would say is like we need to see X-rays, we need to see a consultation, we need to look at the spread. And then in regards to zirconia, a lot of people need to understand. We were talking about making a video about this zirconia and how it's made and its principles, the opacity. When they're using a zirconia puck to actually mill out that zirconia, there's so many different types of zirconia also in regards to its aesthetic properties. Also, the lab technicians staining it, how good they are. So what I've noticed is that we work with a really great lab. We actually don't have an in-house lab technician for zirconia, just because I don't know if you guys are like facing this in your industries also, but I mean, the labor shortages have really driven everything up, right? Even our staffing costs, and also lab technicians and technicians are literally bouncing all over the place looking for a higher buck. And to find people who are the best, like we have lab techs that are making like, staining your zirconia. I mean, this is true artistry. So who you work for, it's really important. So we actually just contract that out, and we don't have somebody in our lab in-house. We do 3D technology for our temps at our office. But yeah, in regards to zirconia, we contract that out. But obviously, we do zirconia. But in regards to who you work with the zirconia, you have to again be very careful. Just because somebody's offering a zirconia arch for X amount of dollars, and that's like 40% off of the next guy, you might want to look at some of their cases too and be like, okay, cool. Can I see some of your cases? And that's a question you should ask. So that'll help you in your search. Let's see here. I have a failed root canal on my front tooth, which I'm getting extracted next week. Should I have a bone graft at the same time? I've been taking amoxicillin for infection. 100%, absolutely. For a front tooth, yes. I'm actually making another video about this. Front tooth implants are the most fickle. Even me being a board certified periodontist who's placed tons of implants over my career, as periodontists, we would be lying to you if we said that anterior implants are still not challenging. And especially the most challenging anterior implant cases are sites that have had infected root canals, sites that are abscessed, which it sounds like you have right now. So like in a case like that, what I typically would tell a patient without even looking at that 3D scan, I'd say, we'll take the tooth out, we'll clean it out as well as we can, because that's another thing that I've also experienced is, again, I placed so many implants in my career. And one of the most common issues that we have, if we have an issue with the dental implant, is root canal sites. Root canal sites, just the bone gets so toxic in that area, and they end up abscessing forever, destroying bone. And you go in and you do a bone graft, and you place an implant 4 months later, and you can have extreme bone loss around that implant, or you can lose that implant. So I actually have another video that I want to put out. I had an implant that I placed back in 2019 on an upper left molar fail. And patient was saying that she gave the office a call and said, hey, been having some issues with been having some issues with this this implant. It's moving. And I'm saying, over that description on the phone, I'm saying 99% of the time it's a loose abutment, and we just need to tighten the screw. And we bring her in. She's like, I look inside her mouth, and like, before we take the X-ray or 3D scan, I noticed that the crown is moving, but then she's like sensitive. I was like, oh boy, actually she does have a failing implant. And so I was like, how the heck is this possible, right? I mean, our implants rarely ever fail. This implant's failing. It's literally 3 years after placement. What the heck is going on? And I look at her old 3D scan, and she had a general dentist that we used to work with, who did the extraction. She had a big root canal infection. She had a huge abscess that you could see on the 3D scan. And I'm going to share this when I share this video here in a few weeks. But my assumption is that the general dentist, our dentist didn't do a good job cleaning it out. And when we placed the implant months later, the implant therefore was going into a site that wasn't predictably cleaned out. And so therefore, one thing that I've learned over my career is that when I'm dealing with these root canal sites, I hit it hard with the antibiotics. I love to hit it with Augmentin, which is amoxicillin on steroids. I clean it out like crazy. You spend more time debriding, cleaning out that socket than you actually spend time extracting the tooth. And then when I see insanely infected sites like I do, and again, I'll show you this scan. It was ridiculous how much bone loss there is. I like to give it more time. I like to give it 6 months, 7 months. And then we take x-rays, see how the bone's looking. Has that bone turned over? And you can really tell by looking at the x-rays, like, do you see particulate matter in there, or does it look like the rest of the surrounding bone? If it looks like on the x-rays that you could see, like, it's almost looks like particles of sand and it looks different than the surrounding bone, then the bone's not turned over yet, and the implant site's not ready yet. And also when we're doing the surgery, another sign that you're going to know that it's not ready is that when you're placing the implant, it's not hard bone. It's almost like a hard, sandy type of texture. So if I was ever to see something like that too, I would just actually stop the implant process and say, tell the place new bone graft and tell the patient to heal even longer. I've seen cases like that. I don't see them very often, but this is again why I hate really infected root canal sites. Oh, let's see. Yeah. So long story short, get a bone graft, and then you might get a 3D scan after that, and then you might even need more bone graft. And hopefully you don't have a high smile line. If you have a high smile line, then you have to be really careful about that. That's a very aesthetically demanding site to place an implant, and that needs to be done very predictably well. So you want to go to somebody good for that. What toothpaste do you recommend? I personally like Colgate Total, but I have, patients who, it's got a lot of great studies for it. I mean, one downside of it is it does have triclosan. Is that how you pronounce it? But that's actually banned from hand soaps. But, I think Colgate was able to lobby to make sure that they use that. And it's, in all the studies for gingivitis, it like Colgate Total is great. And then patients who don't want anything with fluoride, then you got something like Tom's. I have some patients that ask for that. I'd mentioned that you just said to Dennis, he laughs at chew on that side, tooth number 31, get extraction implant. Oh, okay. I should be getting mini implants in a month or so for my snap-on dentures. What's a tactful way you would recommend that I ask my dentist? No, the implants should be should be vertical rather than angled. I don't know. Hey, you know what? This is your mouth, right? Yeah, I'm a really nice guy too, and I don't want to offend people, but hey, just ask him if he knows what he's doing. Uh, but in all honesty, like mini implants. This is something I learned back in residency. Mini implants were always meant to be a temporary solution. Mini implants are, I guess people feel more comfortable placing them, like if you don't have much dental implant experience, because they're more narrow, so you're less likely to perforate your bone, um, either outside the facial or the lingual, the tongue side. I would not use mini implants in my mouth. I would not advise any friends or any patients to get mini implants in your mouth. If you're getting a snap-on denture, like we have narrow platform implants, 3.5 millimeter implants. I mean, I would imagine that your bone is thick enough for that. But the other, like we've created videos about that too. If you look around on my site, we've talked about some of the issues with snap-on dentures. But if you do mini implants, the top of the head too, if it's a one-piece implant, that can fracture off or that can wear over time. So you can have issues longer term with mini implants, and the amount of money that you're paying, you're not really saving much of anything. So I just go to somebody experienced and get regular narrow platform implants, and I would recommend that. Let's see. What are the key things to consider if you're 40 plus years old and considering the removal of wisdom teeth? That's a good question. So people who come to me, and there's always like this, and I get it. I'm a very skeptical person too. So if somebody starts recommending to me, like they're like, "Hey, why do I need to get my wisdom teeth removed?" My dad's 80 years old. My parents are 80 years old and they never got their wisdom teeth removed. My parents that's actually the case. My parents are 76 years old and they've never had their wisdom teeth removed. They're fully erupted. I had my wisdom teeth removed when I was 18 upon my dentist recommendation. Based off of everything I've seen with all my patients, definitely getting older, when you're getting wisdom teeth removed and the complications that can occur, how your wisdom teeth are erupting. Are they coming horizontally impacted? Are they just would it be, are they very close and entangled in the inferior alveolar nerve? These are all things that we could see on your 3D scan. But the more factors that you have like this that are involved, the more likely you are to have complications. And then obviously dealing with complications, are you 28, 29 years old? Are you 40 years old, 45 years old? I've extracted tons of wisdom teeth in my career. I've extracted wisdom teeth at these corporate offices that the oral surgeons didn't want to touch. I always, for whatever reason, and with our practice too, I get patients that none of the surrounding oral surgeons want to take on due to liability purposes. And then patients are just Googling around, they find us. And I take out their wisdom teeth too, just because I feel bad for the patient because they keep on looking around. So why do I say that? It's because wisdom teeth, like you definitely need to do everything you can to get them extracted earlier in your life, because the softer your bone, you know, um, it's a lot easier to get your wisdom teeth out, less chance of complications, having that root hit that nerve. I actually do more coronectomies than I used to, just because of potential complications on older people. It's just not worth damaging a nerve if it's a root is super close to the nerve and you just have like a root tip there. Obviously, we don't want to mess with that and cause other complications. But in regards to like what I would be looking for, considerations, again, um, how often has it been bothering you? Right. That's a question I'll ask you. Has it never bothered you? Then maybe you should not consider it being 40 years old. If it has a history of bothering you, how often is it bothering you? What do you have to do when it bothers you? Do you take antibiotics? And obviously, the issues that are happening when you're abscessing or have pericoronitis, whatever, is because bacteria is pulling up in the area. Then I say another preventative thing is go back there and keep it as clean as possible, right? Brush back there on the gums, keep it as clean as possible. So those are certain things I'd say. And then if you do decide to get your wisdom teeth removed, make sure that we have to assess how impacted they are. If they're horrendously impacted, and you have to weigh the pros and cons. And that's the way I am with everything. I tell people, listen, nothing really has a clear-cut answer. You have to weigh the pros and cons. And I tell my patients this all the time. I'm going to tell you about the risk-reward ratio of every case and the solution, how that involves costs, how that involves downtime. And I want you to make the decision for yourself. I never want a patient to feel that they're being pressured. So hopefully that was able to help. Is zirconia able to look non-opaque? Yes. So there's ways that zirconia specific pucks and the way that you stain them can look more translucent. And then there's other zirconia I've seen done by, with cheaper zirconia pucks and just not as skilled technicians, lab technicians that don't look that great. That's why the failed root canal scares me. A 3D scan shows bone loss, and it's my front tooth. Can I wear a partial while the bone graft takes? Yes, you can. And I'm again making another video about this. You can wear a partial, but the problem with partials is that if you're already telling me you got bone loss, then you're telling me that you have facial bone loss. Okay. So when you're looking at me from the side, you have an outer edge of bone, you have your tooth here, and then you have your outer edge of bone around the root, and you have your inner edge of bone, which is the roof of the mouth, right? And when you're dealing with anterior aesthetics, it's always that buccal bone, that facial plate of bone that determines your aesthetics. Because when you smile, you see the harmony of your teeth, like symmetry. Your central incisors are this height, then your lateral incisors are like this height, then your canines are this height. And so what helps establish beauty is symmetry, right? So what ends up happening is that whenever you've had a bad root canal infection, you end up losing some of that facial bone, right? But that facial bone is what supports your gums, right? So the reason why you don't have gum recession right now is because nobody's tampered with the site. But the moment where you go in and you take the tooth and you basically take the tooth out, which you have to take out, and you start messing with the site, then you're going to see some of that gum shrinkage. And you're going to wonder why you see the gum shrinkage. Well, the gum shrinkage occurred because the bone was lost, the bone is infected, it's abscessed, it's all granulation tissue in there. And when the dentist goes in there and he cleans out the site, cleans out that diseased bone, the granulation tissue, you're going to see some bone loss there, and you're going to see some tissue shrinkage immediately. So what we want to do at that time is you want to basically preserve as much bone as you can with bone grafting. And ideally, depending on how much bone you have lost right now, there's a very good chance that you're going to need more bone. And the type of bone grafting is not going to be your simple extraction socket preservation, your simple bone grafting at the time of extraction. It's going to be ridge augmentation, where we go in and do a more extensive bone grafting procedure. That's when they use titanium reinforced membranes. That's when they use titanium mesh membranes. They use these special types of membranes because they really protect the site. When you have a sidewalk with wet concrete, you don't step on the site, right? Because you're going to distort the site and cause issues. Same with the bone graft. When you're doing a very major guided bone regeneration, ridge augmentation type of bone graft, you cannot have any pressure on that site during the healing process. So you could technically wear a flipper if it's designed in a way and you promise to not push on that site at all during the healing time. I feel uneasy about it because it is your aesthetics. That is your decision to make. But predictability kind of goes down the window with that. Guided bone regeneration is not and I'm literally, it's funny, making a video about this right now. Um, Guided bone regeneration, vertical ridge augmentation, horizontal ridge augmentation. I'm talking about all this in my videos, so you guys have a better understanding about this. But it is one of the most challenging aspects of dentistry in regards to, dental implants and trying to get very predictable outcomes with aesthetics. Hopefully, you don't have a really high smile line because, again, that's what carries the most risk. I'm going to make a video about that, and I'll tell you about all the complications that can happen, what you need to look out for, and all that stuff. Let's see. What are my best options? Who would do tissue grafting? How do I find the best specialist? Typically for tissue grafting, a periodontist. Generalized, right? But somebody was making a comment. I'll finish this this comment that this dentist left earlier. My rebuttal to him. But you can't make generalized statements about general dentists or periodontists or oral surgeons or prosthodontists. Listen, there's some people who care extremely about what they do, and they're just like artisans of their field. They're like the best, the cream of the crop. And I've seen some work done by some dentists and specialists, general dentists too, that I'm just like, oh my God, like I have the utmost respect. Like when you watched Botched on TV, my jaw just drops when I watch like some of the stuff that they do. It's just amazing. And the same goes with every field. And as you can see, that's something, it's in that show, you'll learn, hey, they went to a board certified plastic surgeon and then they had that type of horrible result. And then these other guys that are board certified plastic surgeons were able to give them amazing results. So, why am I saying this? You're not going to go to, there's some periodontists that place horrible implants. Being a board certified periodontist doesn't mean that that guy is awesome at placing implants. Being a board certified periodontist doesn't mean that he's going to be awesome at guided bone regeneration or awesome at connective tissue grafting. I've seen some people periodontists that are amazing at using alloderm for gum grafting and horrendous at doing guided bone regeneration. And so you'll see a periodontist who's amazing at taking out wisdom teeth, and you'll see a periodontist who's horrible at taking out any teeth. And, so just if I was to say, in regards to gum grafting, just word of mouth, testimonials, go look at their Google reviews, go look at their website, go see photos. And I really think that those are the best ways. I actually do have some gum grafting videos too. So if those will answer any questions for you, maybe you guys should check that out. What are the best? Okay, maybe it is regular implants I'm getting. We'll check estimate. Waiting for bone grafts to heal. Yes, awesome. Yeah, just ask them. Don't feel bad about it. This is your mouth. You're spending a lot of money. So, and if anybody that takes offense to like that type of stuff, I mean, it just has a wrong attitude. And let me share this comment that I had with you. I just want to share this with you guys. They said that this title list is misleading. This creates distrust in the public for dentists, along with giving patients this is the part that is hilarious. Along with giving patients a false sense of entitlement to the knowledge that patients think they have in substitution for years of training and experience. This should be reported to the board. I'm assuming it means dental board. Listen, my objective ever since the beginning, I hate to tell you this, but dentistry is like any other field. We have great ones, and we have some bad ones. And so I will never, I don't want to say anything right now in particulars, but I've seen some real shady stuff too back in the day especially when I was contracting. And it was at a corporation that I was contracting at, and it was well known within the corporation. This person had high stature, and everybody was afraid to say anything. And I seen some shady stuff that happens sometimes. So what I'm trying to do is create some truth and transparency. I'm just going to say what I would be looking for. I do sense the frustrations from patients where even me, my dad's a physician, I know a lot about this type of stuff, but if I was to go look for some sort of medical specialist, I wouldn't know where to begin. So I'm a huge YouTube type of guy. I love to do my research. When I learn about a topic, I love to go out there and just research the hell out of it. If you guys watched my videos earlier this year, I started gardening. I was like, wow, these tomatoes are really good. I started noticing like how if you, home grew some vegetables and stuff like that, it was really good. And I literally watched tons of videos about gardening from many different YouTube channels, and it just helps out tremendously and just saves me a lot of time. and effort. So that's been my whole objective with you guys. I want to make sure that you guys have best results. I understand that this can be very emotional. How do we avoid some of the frustration that can happen from bad dental work, bad aesthetic results, or implants failing, or bad, complications, wisdom teeth extractions, all that type of stuff? That was always my main objective. Not here to piss anybody off. I understand that getting some of this information out there is going to probably piss some people off. But I think that when you're saying that giving patients a false sense of entitlement to the knowledge that patients think they have in substitution for years of training and experience, just because we go to dental school or residencies and spend money in the process and learn as much as we do, it doesn't mean that it should be a kept secret that a patient shouldn't know. I mean, I think a well-informed patient is, I have no problem that a patient has expectations in regards to what they should be getting. So if a patient came in asking me about mini implants, then I would take no offense to it. So yeah, Colleen's question, I would take no offense to that. What is all on four? I have many videos about all on four, but basically concept is that if you realize that you're going to lose a lot of your teeth, or the writing's on the wall, and you need some other sort of solution, and you don't want to do dentures, or the funny thing is, I need to create a video about my dad, my dad's scenario. How many people oh, there's 30 people in this chat. Okay, cool. But on my dad back in 2016, he moved to America from South Korea back in 1975. Had all his dental work done for the last 50 years up in Northeast Ohio, where he's practicing as a physician. And back in 2016, he was about to lose his first tooth, right? Well, I mean, he had a bridge actually. So he was going to lose his dental implant bridge up in the upper left, and he was going to lose a tooth in the upper right. And so his dentist knew that I was a periodontist and said, "Hey, go see your son." So he comes down. We did an implant bridge up here, did an implant here. A year or 2 years later, he lost another tooth. Another year, lost another tooth. So long story short, we did 6 implants on him in 6 years. I think maybe even 4 years because COVID, right? So I tallied up all the money I spent on him, that had he not had insurance, what would have been that cost, right? So long story short, he had 2 sinus lifts, extractions and socket preservations, all that bone grafting, the implants, the abutment and crown on top of the implants, and all those appointments in between, right? And and I'm going to make a video about this. I've been saying I'm going to make a video about this for 6 months. But long story short, I spent about 35 G's. The value, my dad obviously didn't pay anything. That's the value I spent on my dad. Okay, that any other patient would have spent. That's a lot of money. And the other thing is, I was making a video on him last March, and I was kind of videoing his mouth and what his smile looked like, because the general dentist that did his crowns, I wasn't too happy about his crowns that were done at different times, because they're different shades. Now, keep in mind, my dad's 76 years old. He doesn't care about aesthetics. He's just, he sees patients and he doesn't care what he looks like. And so I was just thinking, I was like, man, if I spent 35 G's and that was my wife's mouth, would I be happy about it? And I wasn't happy. I wouldn't be, so just because of the crown colors. And then the other issue is, the funny thing is, even though my dad never spent anything, he's gone through all these appointments. And he was like, man, honestly, I wish I did an all on four. I was like, Dad, honestly, I wish I did an all on four you too. I had no idea that you were going to lose all these teeth over all these. I was just doing as the dentist told. He had all these crowns and bridges, and they unfortunately were all ticking time bombs. He had a lot of root canals, and they all decided to implode at the, in a 4-year span of time. Well, the sad thing is that he still has 4 natural teeth left, and now those are extremely loose, periodontally involved, and I need to take those out and do an implant bridge on him. In the end, I'm probably going to spend about $42,000, something like that. So that's literally double the amount. I could have done a full mouth of all on four. So to answer your question, all on four is just basically it's all on four, just placing 4 implants and having a set of teeth that screws into it, right? So that's an all on four, right? So you save half that money, right? And it's a way quicker procedure, and you're done with it. So all on four is a great option. I really do. I love it, so it's not for everybody, but if you are one of those patients that, again, the writing's on the wall, whether you have periodontal disease, a ton of root canals are going bad, or crowns and bridges are going bad, it's definitely something to consider. And also the aesthetics look amazing. So, you can check out our all on four videos, and we talk a lot about it. You can check out our website, see some before and afters, give you a good sense. We try the best we can to educate people on this. If your teeth are yellow, are they clean? Yeah, I mean, that's just I mean, my teeth are not exactly the whitest. I can't whiten my teeth. My teeth are so sensitive. So, but as long as you don't have plaque and tartar on there, right? So, I mean, they could be yellowish. I want to ask about the risk of nerve damage for dental implants. So when you're doing dental implants, the nerve that we're always worried about is the inferior alveolar nerve, right? So that's the lower jaw that runs along the lower jaw. It runs on each side. And basically, the way that we used to do it is that we would basically have an X-ray, and we'd say, all right, how far does that nerve look? And then we say, all right, what I'm going to do is, I think that looks like it's 13 millimeters away. I'm just going to eyeball this. This is the way that we used to do it back in the day, right? Then we'd numb you up, make an incision in your gum, pull your gums back, see your bone, do a little pilot drill, place that drill for a certain distance down, take an X-ray real quick, and be like, all right, how far does that drill tip look like it is from the nerve? And then, okay, maybe it's like 3-4 millimeters. Let me drill a little bit more. Okay, let's drill a little bit more. Take another X-ray. Okay, let's see how far that really is. So that's how they used to do it. Some people still do it. If you're placing dental implants and if you're not using a CBCT 3D scanner, then you're in the Stone Ages. You're not doing your patients the right, thing. So, but to answer your question, you would use a CBCT. If you needed an implant on your lower right first molar, I mean, yeah, I would basically get a CBCT. I would see how far the bone is from the nerve. I have an exact measurement of how far that is. It'll say 13.5. Great. I'm going to go with a 11.5 millimeter length implant so I don't hit your nerve. And then, obviously you could take x-rays even after your first drill, confirm that, and then be like, all right, good. And then finish your implant. So if you have somebody that's, well experienced and knows what the hell they're doing, plus they have a 3D scanner, I really don't think that the risk of nerve damage is actually really, 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 really low. What do you do when an ADA disabled and office manager sent via email a PSD, couldn't open files, and ended up telling me go elsewhere, gave 30 days to find someone else? What is your take on this? What do you do when I am ADA disabled and office manager sent via email a PSD, couldn't open files? I'm not sure what the PSD is. Maybe the 3D scan. So when people send me 3D scans from other offices, sometimes I can't open it. So I could see how that's an issue, but ended up telling me to go elsewhere. I gave 30 days to find someone else. Honestly, I don't have an opinion on that. Couldn't tell you more about that. On tooth 2 and 3, I had a tiny cyst that was there. My ENT said that would interfere with my sinuses. How long? Oh, whoops. How long can I go without doing anything unless abscess comes back? So you're saying that on tooth number 2 and 3, you had a tiny abscess from a tooth? Said that this would interfere with my sinuses. How long? Yeah, I mean, root canal infections, maybe it's a root canal infection. I have seen people have issues with their sinuses, had procedures with ENT, still had issues. I'd seen them later on. We took out the root canal tooth and the sinus issue clears up. I don't know if that's the case in this case, but I would have a 3D scan done and evaluate. The scan that and the software that we use versus ENT is pretty different. So any oral surgeon, periodontist, any general dentist, whoever you're going to see to get an evaluation, I would say have them get a 3D scan and kind of evaluate. Can you chew gum with the permanent zirconia arches top and bottom? Is there unusual loud clicking? So that sound, yes, you can chew gum. That sound is so overrated. People say that it sounds like fine china clacking, and then I've like literally, I'm like the few times I ask a patient to do like imitate chewing for me, like I don't hear that. So I don't know why there's so much, like it's almost like propaganda that other people like try to put it like, against zirconia. I mean, if I need it all on four in my mouth, I would use zirconia. I know we offer other solutions like, crystal ultra nanoceramics and all that type of stuff. But in my mouth, we offer other options and it's the same cost. I have no incentive to try to sell one versus the other. I just want patients to be happy and not have issues over the long haul. And in my honest thought, I think zirconia is the best solution for that. All the things that they talk about with the weight too, like I don't see that. And like when I have like put it in patients' mouths and I ask them, do you feel the weight? And they don't feel it, but if there's so much negative talk about zirconia and saying so much about the weight and the clanking, and again, I'm wondering what the agenda is, why these dentists are telling you that, then I think they're honestly trying to psych patients out from trying to get zirconia. But I don't necessarily agree with it. Again, I have no incentive. Like, if whatever you want, if you want the nanoceramic crystal ultra, great. If you want regular acrylic, great. If you want zirconia, great. There's no difference in cost for me. But that's what I see. I see over the long haul too, in regards to aesthetics, chipping, all these things. I think zirconia is way better than some of the other best options out there, like nanoceramic. I think aesthetics with zirconia, years out, looks amazing. It looks like day one. You can't say that about some of these other solutions. I live in Florida. I was wondering, am I allowed to go to Texas and get a consultation and see if I'm a candidate for all-on-4 there? I don't know how it works between states. Yes, we actually do have quite a bit of patients that come in from out of state for all-on-4. So just give us a call and we'll be more than happy to set that up. I'm 22 years old. At 17, I had 2 front teeth knockout all this time with temporary prosthesis attached to the gum. Your advice: first, I need braces, make bone growth implants. All right, so something that concerns me. At 22 years old, now 17, 5 years, and you're still growing at that time, your bone loss is most likely going to be significant. And also, it wasn't a fact that you had those teeth, like what we call atraumatically, non-traumatically extracted, let's say by a dentist. It was traumatically taken out, whether, we've seen tons of patients like this, whether it's a baseball bat, whether it was punched to the face, whatever it is. When that happens and you get hit, the root that was there then gets avulsed and a lot of times knocks out that thin bone that was covering it, right? So when it gets hit, the tooth down here gets hit, and then the root gets hit like this and then fractures that, what we call the facial plate. And again, I was talking about it like 20 minutes ago. That facial plate is super, super, super important to determine where your gum levels are going to be and your aesthetics. Therefore, keep in mind, again, your gum line follows your bone. Your gum follows your bone. So if your bone is not where it ideally needs to be, then your gum is not going to look right. And when your bone and your gum are not right, not only does it affect your implant aesthetically, but also it can contribute to future periodontitis, having issues with your health of your implant. So that's definitely another concern. Why you need, what do you do about it? Guided bone regeneration. So you would want to evaluate a special with a most likely oral surgeon, periodontist in your area, somebody who's very well adept at doing guided bone regeneration. Get a 3D scan, take a look at that, have them, give you their best recommendations about how to move forward. Hopefully you don't have a high smile line too. So high smile line, when I keep saying that, when you smile, do you have like a Julia Roberts type of smile when I see all your teeth and gums? Or do you see like, just the top of like just like 3/4 of your teeth, something like that. The less we see of your gums, the better for aesthetics. This is informative. Thank you. I'm going to try to do this once a week, maybe on Saturdays. Can I completely negate, offset the damage done by carbonated sugary beverages if I chase them down with a cup? Plaque, that's the biofilm that's on your teeth, is always sticky. So I'm sure that will help, but no, I'd say no. You definitely should brush your teeth afterwards. Is it absolutely essential when you have bone loss to get bone graft with extraction? Yes, I would, 100%. Let's see, feldspathic or porcelain veneers. Honestly, that is not my forte anymore. I'm like, ever since I graduated dental school in 2008, I just checked out with the general dentistry aspect of it. I have basic knowledge, everything I learned, but I don't practice it every day to tell you in regards to like the best aesthetics. Our dentist here could definitely help you with that. Hi, if my tartar's moved and because of if my teeth became loose after the procedure, tartar was a bit acting like cement, which it does. Yep. Would they little by little become stronger if I take proper care? Yeah. If you are careful in regards to how you are biting down, just the less you bite, like I would try to just, like, if they're your front teeth, right, just what I would say is use a knife and fork, chew with your back teeth for as long as possible. Also, when you're biting, are your teeth like, in traumatic occlusion? Do your lower teeth always contact your upper teeth when you're biting up and down? If it is, then a lot of times what we'll do is we'll do occlusal adjustments and just kind of grind down the front teeth a little bit so they're not hitting so hard. Another thing you could do is you could put like a lingual bar. It's like a lot of times after ortho, they'll put like a lingual retainer on your tongue side of your lower front teeth. They'll put a little wire and they'll use composite to bond it in place so that your teeth aren't going to move. And so we also call that splitting your teeth. So that allows your bone to kind of like firm up, bone and gum to kind of firm up around your root of your tooth again. So go to your dentist and get his thoughts on that. What complications can be from implants and bone augmentation? Can there be an infection that will provoke the removal of healthy adjacent teeth or something else? So implants and bone augmentation. It would have to be like to basically there always is a possibility that if you have a horrible infection on a dental implant and that implant is super close to an adjacent tooth, that it could do damage to the adjacent tooth. Yeah, you're 100% right. That's why when you're placing an implant, preferably most of the time would try to place an implant that's not going to be super close. Also, that's preventable too. That if you were to lose bone, you want to make sure that, um, parent like bone loss or periodontitis around a dental implant doesn't happen overnight. It's usually like a multi-year process, right? So going into the dentist like every 6 months, whatever your regimen is, 3 to 6 months, getting your cleanings, getting X-rays, and then they'll see any changes like that. Well, your hygienist or your dentist will see stuff like that, and so you want to get stuff addressed at that time. So that shouldn't be an issue, but it's always a possibility. Blessings, well, I stumble upon this now. Thanks. I have white fillings that have fallen out. Just had it done at least one. Yeah, well, what the heck? Just. Oops. Oh yeah, sorry. Done at least 1 year. What should I do? Go see your dentist again. Get those fillings addressed. Maybe you're they weren't. Sometimes they can come loose if they were contaminated during the filling process, like saliva got in there, so the bond wasn't really tight. That's how you'll get sensitivity too. Also, fillings can come out because you're grinding or clenching. Certain factors come into play, so just get them redone. Not a big deal. Sometimes if they're really huge fillings, then you might need a crown. Would you do a small makeover case? I would love to have you do my work. We do those cases sometimes. We're actually, let's see, we do a lot of smile makeovers, and we are actually going to do a pro bono case here in the next few months. We're going to release something on social media, Facebook, Instagram. Follow us on Instagram and Facebook. It's at North Texas Dental Surgery. But we are going to do something for the community. We'll do that for somebody here soon. Just kind of, we've been insanely busy. So just trying to find the time. We've been talking about it, trying to coordinate it and making sure that we can get the word out there, and we're just kind of like planning that all out right now. Is it advisable to replace silver fillings with white fillings? Are there contraindications? That is such a controversial topic with the silver fillings versus the white fillings. When you're getting those fillings out, how much, mercury are we releasing? Like I know they have all these little contraptions to try to isolate as, use a rubber dam and the special type of vacuum. But those amalgam fillings, those silver fillings are also really great seals. And I understand the whole holistic, I don't have a firm opinion about it. I'm very open-minded to both sides. So again, I've been wrong so many times in my life. So I hate to make a blanket statement in regards to, without even seeing your case, whether you should do something like that or not. And a lot of times people are going to talk their book, yeah, you should do it and get silver, composite fillings, or other people say no, and you should do completely holistic. And then it costs, some of these holistic dentists are super expensive, but. All right, let's see. Hi, doctor. What is your view on gum disease, periodontal disease, and xylitol and ozone therapy? I read many good things about xylitol in the pure form as a sugar. I remember learning about xylitol a long time ago. Ozone therapy, I'd love to look more into this. My thing is, the holistic side of stuff. I want to be very open-minded. I also understand that people use a holistic angle to charge patients more money. So I'm very aware that there may be different agendas at play. So I will always advocate for the best treatment for the patient. So if it works, great. I'd love to offer it sometime. And I just need to do more research for it. So that's kind of like my take on it. Raymond Hong, what should I try to learn in my last year of dental school? In my journey, what do I wish I learned? I mean, it's really different, right? Do you want to associate? Do you want to own your own practice? I think that being a dentist, it's not just what you're doing in the chair and doing your crowns and fillings. It's also having compassion for the patient, also being able to listen. I think one of the biggest frustrations is a lot of dentists don't listen. So anything you can do to one thing that I really say, I've been practicing for 12 years. Back in 2015, had about multiple practices. Something happened. Long story short, it was a very well, what it was like, my manager had been embezzling for me, so I had to fire her. And so like this person that I had leaned on extensively wasn't there anymore, and so it really stressed me out, right? So that was the kind of the point where I went through this path of self-development, and I'm very passionate about books and podcasts for self-development, not being victim mindset, taking ownership of your life, and just focusing on improving you, right? So being able to communicate with patients, having empathy, understanding where they're coming from, not being a dentist just trying to tell people things that this is what they have to do, but explaining to them why things happened that they did, how this happened, what we're going to do for treatment options. Let them choose the option. Obviously, give them the best course of direction. And also, after the end of treatment, letting them know, kind of like, making sure that they come in for their, maintenance appointments, their recalls, right? Because nipping things in the bud with small cavities is a hell of a lot cheaper and less invasive than taking out a tooth and doing an implant or root canaling a tooth, right? So those are some quick things, pieces of advice I would give. If I experience pain and sensitivity on one tooth from hot and cold beverages, food, what is this sign of? I don't see a black dart. That's a good question. Gum sensitivity, do you have recession? Go get pulp testing with your general dentist. They take x-rays. They could look and see kind of like what's going on. So I would go see your general dentist. Thank you. Should I get a apico or dental implant? All right. I got a firm answer for this. Do not do an apicoectomy. All right. I like and I know I'm going to rub some people the wrong way. Okay. I had a endodontist up in a city close to here, like literally threatened me one time. I told it was like the craziest story. Maybe I'll make another video about it one time. It's just a funny little story. I had a patient come in from, this was about 4 years ago, 5 years ago. I think 4 years ago. This patient moved here from California. She moved here when Toyota moved here to Dallas and to Plano. And I did an implant on her in the lower left. And I was telling her that when I was looking at my 3D scan, she was referred by her general dentist to me. And I looked at I looked at the adjacent tooth on the x-ray, and I was like, we become very tunnel vision because when we're referred to do one thing, we don't just start scanning the mouth for all your cavities and all these things, right? But I was looking at her scan, and I was like, wait a second, what's this radiolucency? What's this darkness? And then I looked at her 3D scan, and it showed a huge abscess from a failed root canal on 2 of her upper right teeth, right? And so then I told her, I was like, hey, you have a huge, abscess up there. I was like, you should probably take those teeth out. And then, one of them is a second molar. Maybe you need an implant there, maybe you don't. But one of them is a first molar. You should definitely get that replaced. But then she was like really shocked because, it was almost like disbelief, right? And come to understand that this root canal had been done years ago in California. So it was a really old root canal. And I had the referring dentist said, hey, you know what? But the endodontist I work with is like really, really upset and he wants you to call him. So I was like, well, what is it about? So I called him, and he was literally like threatening me, like it was almost like the craziest call, but he was threatening me, saying like all these things that he could do and like get me in trouble and all this stuff. And I was like, what had happened was that he had done a root canal on the number 18, which was lower left, which wasn't even the tooth I was, talking about on the upper right. He thought I was talking negative about his tooth and how he never should have gotten a root canal and how he should have taken out. And it's amazing sometimes it's like things are lost in translation when you tell something to a patient and then what is told to another dentist, because I understand that there's a lot of confusing things that are said. But yeah, that was like the craziest thing that happens. But in my practice, I see tons of failed root canals. I've seen patients that come in that have had multiple failed root canals. In my mouth, if it doesn't work on root canal number 1, I'm taking it out. I'm doing an implant. Long story short. So don't even try apicoectomy. I've seen a lot of patients that have the apico and then they still end up getting a dental implant. And just when you do the apico, then are we getting up involved in the sinuses? What is the bone looking like later on, years later when we're doing the implant? So, I mean, obviously I'm biased, but that's, from what I see. Well, so chasing it down with water doesn't completely offset the negative effects of carbonated sugary beverages. I should wait about 30 minutes till I brush my teeth, right? Due to pH changes. I mean, honestly, with the pH changes, I don't know. Like, I'd say brush your teeth immediately. I'm not an expert on that. Okay. What is the process of maintenance cleaning of a full zirconia, upper and lower, all on 6? What would be the general cost? So here right now with all on 4, okay, so they call it all on X, right? So all on X because every case is different. How many implants do you need? They found out through research that you need technically, as long as you have good enough spread with your dental implants, you need only 4 implants, right? Again, key thing being, do I have enough spread from your front teeth to your back teeth? Now after that, like any more implants that we place, whether 6 or 8, the goal would be to be offering redundancy, right? So if I got a square table and I have 4 legs, all I need is 4 legs, right? But what if somebody decides to kick a leg out? That table's falling. But what if I had 8 legs that were all positioned in optimal spots? You kick out 1 leg in the corner, you're still fine, right? So if you did 6 implants, it's not about just placing 6 implants all right here, because if you lose one of the front teeth, then great, that's fine. You have redundancy. But what if you only had one major back support that, when you're chewing, most of your back teeth are taking the pressure, right? So if you only had one implant back there supporting the back teeth that was giving, and you don't have redundancy, you don't have an implant past that because of sinus involvement, or you don't know how to place pterygoid implants, then you're going to have, you don't have the redundancy, right? So what we do right now is we've been placing as many implants as we need to at a fixed cost. I'm thinking about this, pretty soon here because we are insanely busy. And on most patients that I have, I place 6 implants per arch to give me that redundancy. So patients have that extra insurance long term to even lose an implant. But I'm thinking here soon that that price is probably going to go up a little bit just because I need to at least cover my costs of my implants. Let's see, what was that question? What is the process of maintenance, cleaning? And so that basically is you go in whether once or twice a year, depending on how good your hygiene is, and we literally unscrew the prosthesis out of your mouth, clean the abutments real quick, and then put your prosthesis in the ultrasonic cleaner. That's it. It's real simple. And the beauty of zirconia is just, it's when it's highly polished, it just doesn't want to attract bacteria. That's the amazing thing about zirconia. One side of my lower jaw is lower than the other, and my denture seems lopsided. The weird thing is that it's a side where bone loss is lower. That looks like dentures are slightly higher. Why is that? That's a good question, but that should be an easy fix. Just make sure you go to somebody to have your denture taken care of. Here's the thing about dentures, guys. You got, I'm not going to name names. I don't want to get in trouble, but you got all these really cheap denture places, right? And they'll give you $300, $400 dentures. And it's literally like you going to Salvation Army and finding a shoe that's a size too big or whatever, or just loosely fits. It might be your size, but it's a lot different than a custom fit orthotic. But going for a custom fit orthotic would be the snuggest fit for your foot. And if that shoe could last for the rest of your life, wouldn't you just get that custom fit? So, I hate to tell patients, but a lot of dentistry, you get what you pay for, right? Well, not all the time, but hopefully you go to someone that's also a good dentist. But a lot of times you get what you pay for. So if you go get a denture, just don't look at the $300, $400 denture. Go to someone that's reputable, has great reviews, that's going to make sure that they listen to you and what you want and get you to the finish line. I don't know if you can put a screenshot of the x-ray on here. You can try. In general, after treating periodontitis, cleaning on a few teeth, are those teeth doomed to be lost eventually, or they can get back to normal? No. So when we do periodontal disease is like anything else in life. It's caused by bacteria, right? So the whole, it's like high cholesterol, high blood pressure, hypertension, high cholesterol, like diabetes. It's a condition where you're always going to try to manage that condition, right? So there's not a cure. We wish we could take some antibiotics and we just got rid of it. Then if there was, then there would be no need for treating periodontal disease, right? So, but the challenge is, again, if you watch my like, I highly recommend you watch my periodontal disease video. I try to do the best I could to dumb that down, explain periodontal disease, and explain all the options and what we can do about it. But if you follow that video and you do everything that you need to do, and you do, and just have the mindset that it's not that you're going to your periodontist for a cure, okay? Like, he can baseline you, get you to where you need to be again, but it is how good that you take care of your teeth, how you brush your teeth, how you floss your teeth, how you use interproximal brushes between your teeth. Are you using mouth rinses? Like, are you doing all the things that you can to make sure that your deep pockets are going to come back? So, they're not doomed. I mean, but again, I mean, what am I talking about? Do I have 80% bone loss right now? And are they really loose already? Then yeah, you're buying time, right? But if you have 4 or 5 millimeter pockets and 20% bone loss, then they're not doomed. You just need to be extra cautious about that and take really good care of those teeth. Let's see. Is there any way to remove fluorosis? I don't believe so. I've never heard of any option to do that other than people, doing aesthetic changes like veneers. I have left tongue, teeth, and lip numbness from a third molar removal surgery for 8 months now. What can I do? Man, I had another person text me on Instagram about this recently. She had numbness for 2 months. Go see a oral surgeon, neurosurgeon. Not everyone takes care of these types of issues, but 8 months down the road, you need to see someone really quick, because when you do like lingual nerve repair, teeth and lip numbness, it seems like everything is numb on you. You like, anyways, your inferior alveolar nerve and your lingual nerve, but that's something you need to get addressed immediately. I just got diagnosed with gum disease, pockets 2 to 6 millimeters. Is there anything you recommend I stop eating, or should I change? I mean, diet wise, I don't think you need to really change anything diet wise. I really think that you, again, need to find the fear of God, and just, brush your teeth 3 times a day, 4 times a day. Use those interproximal brushes, floss after every meal. It's, bacteria that's causing these issues. So those are the things that I find that I have the best results for. Like, of all the patients that I do, whether laser gum surgery or osseous surgery, patients that have the best results are the people who just have that fear of God in them afterwards. And I bring them back, 1 to 2 months after, and I'm probing their gums. I'm like, holy crap, your teeth are amazing. And it's just those people that are like, after 3 years of residency and 12 years of practice, I've noticed that it's the people who have that, just they are just religious about taking care of their teeth. If I can't floss due to my extremely crowded, tightly packed teeth, yes, that is very frustrating. Actually true till I get braces. If I go and get a dental cleaning, how long will its effects last till I need another session? I mean, that's a hard question to answer. Just do as good of a job as you can brushing. I heard that after brushing, in order to leave more floor, is it better to not flush with water and just spit out the excess paste foam? Is that accurate? I prefer to spit it out. That's me personally. I know some other people might say it differently. Do you think implants are always the best solution despite the risk, or can you live with a temporary prosthesis all of your life, even if you only 22 years? I haven't. 2 front teeth, smile not high. I mean, that's a personal decision. Like, I've seen patients who've had work, like, and those temporary teeth, the flippers. I've seen people wear those for decades even, and then you have to build up that bone before you place those implants. But that's one of the biggest factors. You really need to build up that bone really well. You have to have enough, and I need to release this video, but you need to make sure you have 2 millimeters of bone on the outer edge. So your dentist needs to really do a good job of prepping that site with a really good bone graft, making sure you have enough gum thickness, also placing your implants in the right positions. Anterior dental implants, you should definitely go see somebody who's really good at it. Go see a specialist. I recently got it all on 4. I'm wearing my second temporary. There is a weird pulsing sensation going on. Is that normal? Must be pushing on an area too much. That's my thought. And depends. How long ago did you get that? I need number 4 tooth 14th or 14 tooth extraction, or number 4. I don't have the money for a bone graft. Do you recommend just leaving the bad tooth in until I can afford the bone graft? I want to get an implant in the future. And how long does it take before your teeth shift when? Okay, so in regards to like last question first, how fast before it starts shifting? Man, honestly, I've seen patients where it's hardly shifts after a few years, and I've seen other patients where I cannot believe how fast it shifts. Like literally in the span of months, it shifts so much. That's a really great question. If you're doing Invisalign or braces, then you don't want to place the implant. If you're depending on how bad your teeth are. If your teeth are really out of position, then what you want to do is you want to move your teeth first, then get your implant. Once you get a dental implant, you can't move that implant. So just keep that in mind. Um, and then if it's going to be that long and you need to do a bone graft anyways, 14, if that's number 14, right? Or number 4, do you need a sinus lift? That's another question. If you're not going to get an implant for a long time, another thing to consider is getting the bovine bone graft because it can last longer. If you use human bone, like basically after 12, 18 months, your bone can start like shrinking again. So bovine is cow bone. It has a tendency to stick around longer. Recently had dentures, thinking of replacing lowers with implants. How long can I wait before I get them? Before no longer possible. Financial reason for waiting. I mean, as long as you have it's not about how long. It depends on it's all about bone shrinkage, and we could never sit here and predict how fast your bone's going to shrink. So we'd be lying to you if we gave you an exact timeline, right? So I have no idea honestly. All on 4 or 3 on 6. Me personally, all on 4. Cross stabilization, implant spacing, aesthetics. All on 4 definitely gives more predictable aesthetics. I have leaky gut that I learned caused my inflamed gums and cavities at the base of my teeth. I want to periodontitis. He wants to do a nap. Is that good? Okay, so how bad are your cavities? And as long as everything is restorable, then yes, follow that option. You can do Linap. What was I going to say? Just keep in mind, guys, that when you go to a dentist, I'm going to make another video about this, that you want to look at the big picture. Like what drives me nuts. And I'm so insanely busy, but I've been wanting to make this video for probably over a year now. What frustrates the hell out of me is when I have patients that come in and they're like, I need teeth. I can't chew. And I look inside their mouth and they have like 4 natural teeth and like 1 implant with a crown and 1 implant that doesn't have a crown on it yet. The treatment options have to be given in an all-encompassing, type of solution. Would you ever it's almost like taking advantage of people. If you were to go in and you meet an old grandmother, she's like, yes, I was watching HGTV and I was like, there's a beautiful countertop that I want. And then the general contractor is just kind of looking around, sees there's a leaky roof, sees that the foundation's a little shifted, can see that there's cracks in the walls and that stuff. It's like, great, yeah, we're just gonna do this granite, this type of countertop. It's $10,000 or $50,000 kitchen bathroom model when we don't even know about the longevity of the home, right? So it needs to be big picture. And then going from there, does this make sense? But unfortunately, a lot of times people will just give people that root canal or that implant because that person's in pain and say, yeah, let's do an implant. Okay, cool. Right. But then they're literally finding themselves here like 2, 3 years later. And they're like, I still can't chew and I still hate my smile. So got to have the big picture first. Right. So yeah, that's why I brought that up in regards to, the Linap, like do the gum surgery if the teeth are all restorable too. Right. But don't do the gum surgery if your teeth aren't restorable. And I see a lot of that, I'll see a lot of people doing crowns and fillings and root canals, and then the patient's got severe periodontal disease and the teeth are so mobile. It's like, what are we doing here? Right. So can the absence of 2 teeth provoke bone loss so much that adjacent teeth would loosen in a few years? Eh, Sometimes. That's a hard answer to give definitively, but sometimes. The lopsided lower is immediate denture with soft reline on 7, is that 2020? Getting new dentures per your video and address lopsidedness occurring immediates with dentist. Okay, yeah, that sounds like a great solution. When they keep in mind when they do their try-in, when it's made of wax, like in teeth, make sure that it's fitting good and it feels good, because any changes that you need to have made are at that appointment. Will extreme overbite affect the outcome of an all-on-4 placement? No, that's not an issue. Just make sure your dentist knows what they're doing. I have periodontitis. Once my teeth are all extracted, is the gum disease fully gone? Or does the bad bacteria still remain? Like, no, the bacteria is gone. So you can do dental implants, you can do snap-on denture, you can do all on four, you can do whatever you want. So yeah, the bacteria will be gone. No, you don't have to do perio maintenance with them. Like, I mean, if you, let's say for example, you did snap-on denture all on four, right? You would still want to, like, again, and that's what they want to do every 6 months or a year checkups, that you still go in and see if there's any issues with your implants. Now, I would bet that you're not going to ever have any issues, but you just can't be, can't be too safe, right? So I would still go for follow-ups. So you're far the only doctor who inspires respect and trust. I'm sure money's not the main thing for you. Everyone be. Oh, I appreciate that. Who doesn't love money, right? But I believe that I'm 44 years old. My philosophy has changed. I've never really told people this story, but I graduated residency at 33, and just like any other guy, I mean, come on. I mean, I felt like I went to UCLA for undergrad, saw my college friends like going out to Vegas or Europe and having trips, and I was in school all those years, right, racking up debt and just feeling like a caged animal. So truth be told, coming out at 33, of course I wanted to make money. Hell yeah, like, and I've been practicing 12 years, but I mean, like, I always felt that you can always make money the right way. I worked 5, 6 days a week, depending on the week, worked my butt off, but I was always trying to do the right thing too. But my philosophy has changed a lot in life. I got kids now, I got a family, and you know, more, it's like life is now more about kind of like doing the right thing and just trying to leave a legacy and trying to leave a positive impact on the world, that one day when I do die, that people will say that I was a good guy. That's literally one of my main things. And raising kids right. So I think we can do good dentistry, make patients happy. Nothing makes me happier. I mean, it's kind of crazy, right? Everyone, like, I have friends who are dentists too, and they're like, "Oh, when do you want to retire? When do you retire?" I was like, I love what I do. I mean, I work my butt off. Um, Sometimes I'm like, literally my days are crazy running around, like, seeing all the patients that I do. Am I going to be able to keep this up? Like, till I'm 65? I have no idea. Hopefully. Um, I'm seeing 1 to 2 all on four patients per day. My back hurts sometimes. My right hip hurts sometimes because the way I'm always leaning. But I really do love what I do. And what my whole main objective with this YouTube channel was always to bring truth and transparency. Um, there's a way for our business to thrive. I think money is just a barometer of success. If we're doing the right thing, if patients are coming to us, then we're making money. That's great. There's nothing wrong with it. I think that when you start doing unethical things, obviously there's a huge issue with it. But that's just kind of my take on things. But let's see. During an upper tooth removal, the roots broke off and went into my sinus cavity and needed to have oral surgeon remove them. How often does this happen? Can get expensive with no dental insurance? I would make an argument that you can actually have a root tip. It is a pain in the butt when you have a root tip break off and go into the sinus, because it's most likely going to still be locked in the Schneiderian membrane, or maybe it's not and it gets underneath the Schneiderian membrane. I do sinus lifts like crazy, like so many of them. Plus, I do tons of all on four, so I see this type of stuff all the time. But I think that you'd be fine, you know. But yeah, like, I don't think you have to do like a Caldwell Luke and go get those root tips out. I think like a round of antibiotics, like with Augmentin, if you can take penicillin, I think you'd be fine. To me that I study so much more information that I could already be fair. When I started to study my question about implantation, it seemed to me that I studied so much information that I could already be a professional myself. That's the goal, right? I mean, shoot, the more educated you are about stuff, the more you can diagnose and find out when things are going wrong, right? I mean, I really think that this new implant series that I'm coming out with is going to be like, it's not overly detailed, but it really lays down the basics that any other topic that's going to come up, then I'm going to refer back to people. And if they understand these videos, I really think you'll understand a ton about dental implants and you can start placing your own dental implants. Well, obviously you have to go to dental school. Can you clean under an all-on-4 with a water pick? Yes, you can. Yes, absolutely. We always give our patients a water pick. I have moderate periodontitis, and thank you for that. I really try to be a good person. I have moderate periodontitis. Can bone loss be fully stopped with treatment? It can be, but keep in mind that depending on how much bone loss you have, that can have an impact on your aesthetics. So I have two all-on-4 surgeries tomorrow, and one of them is a patient that has pretty severe periodontal disease. She's had osseous surgery before. It's affected her aesthetics. She's consistently losing bone, so she knows that the writing's on the wall. And she's an attractive female in her younger 40s, so that's why she's looking at an all-on-4. And I actually created a video about that for periodontal disease and all-on-4. So that's one thing that I tell patients, like, we have to be careful for, because when you have periodontal disease, you're losing bone. When you're losing bone, your gum will start shrinking back, especially after surgery. Lesser with the laser gum surgery, but you still see shrinkage. And so you see the black triangles. And when you see the black triangles, that affects your aesthetics. So that, especially on females, I don't know how old you are, Danny, but I mean, that's what I worry about. If you're a 60-year-old male or female, chances are you have a low smile line. I'm not really worried about it. But for patients that have, this, then it's a little bit more of a concern. But again, what are we talking about here? Like, is it 4mm, 5mm pockets? I mean, just try to save your teeth, right? Do you have a high or low smile line? There's many different factors in our decision tree as to what we decide for treatment. So, my dentist said gum disease can only be slowed down, and I'm bound to lose my teeth in 15 years. Don't be so pessimistic. I mean, I'm talking to your dentist. He shouldn't be so pessimistic. There's hope. And again, like I said, send me, just send me your x-rays and I'll give you my honest opinion. Contact at northtexasdentalsurgery.com. Send it to me. My staff will show it to me. I'll give you honest takes, my honest take. Give me take like an iPhone photo, shoot it over to me. You can also DM me on Instagram at North Texas Dental Surgery. Follow me there, guys, on North Texas Dental Surgery's Instagram. We try to put stuff on our daily feed too. We try to have a fun time, right? So, I don't know if you guys, get the way that I am. I'm very serious about what I do, but I also love to have fun. Our staff loves to have fun. But we just try to show some of that on our Instagram. But if you DM me on Instagram, North Texas Dental Surgery, then I'll answer you. Send me a photo, smile real wide, tell me what your pockets are, show me a copy of your x-ray. That's what I need. By the way, what do you say to clients after implantation about smoking cigarettes and marijuana? I asked separately because there is no nicotine in marijuana. By the way, the safer thing is don't smoke anything. Gummies, that's what I would do. Message was okay. I have a number 12 build up and number 13 both need crowns, but 12 was fractured. Her dentist said that she puts crown in my break due to not knowing how short it is when it broke. What do I do? I would, if it's gonna, we shouldn't. It sounds like you shouldn't crown it. And again, whatever treatment you choose is based off of predictability. If I invest this amount of money in it, what is my long-term prognosis, right? So maybe you do an implant or a bridge there. What's an all-on-4? If you watch this video later on, I explained it earlier. So somebody else was asking me about that. Are all-on-4s covered by dental insurance? Some very, very, very rare dental insurances. And I'm talking about very rare. Most dental insurances will cover usually the extraction portions, maybe some of the implants. Whether your max is 1,000, 1,500, 2,500, 3,000, that's typically like what we'll see. But I think most people, it's like $1,500, $2,000 max. Do I leave a bad tooth in if it can't get an implant or bone graft? Number 14 was root canal I had done and the filling came out and didn't get it replaced. So now it has to be pulled. And its filling came out and didn't get it. I mean, it's root canal, so you're not going to have nerve pain. But the problem is that the root canals, I'd have to look at a 3D scan. Root canals have a tendency to abscess or just have long-standing chronic infections that patients won't feel because you've lost your nerve there. And it's never good to have a huge infection in your body like that. So I will get it out. I wouldn't worry about passing on to your long-term partner. What is your email address? It's contact@northtexasdentalsurgery.com. Actually, I'm really going to check that. So DM me on Instagram, okay? North Texas Dental Surgery is our Instagram. So just DM me. I hardly check the Facebook. And I hardly check the email. So if that helps you out. All right. So what was I wanted to answer some of the other questions here that people had. So long story short, to summarize, when I first started this live stream, somebody was asking me, he was a general dentist. He says, hey, I use guides. I use 3D scans. Hey, some of the other specialists in my neighborhood suck. So, like, what's so special about you guys? Listen, I'm not attacking anybody. And like I said earlier in this live stream, everybody's capabilities are different. And just because you go to a residency or you carry a board certified prosthodontist, periodontist, oral surgeon, I hate to tell you guys this, it doesn't mean that much. I'm board certified. I passed this test. I don't think it really meant anything about my capabilities versus some of my other friends that are board certified. And I'm just telling you the honest truth with all of this stuff, right? So it's so hard to find. I can only understand if I was in your shoes. Like, how do you find the right guy to do your work? I have no idea. But again, with this comment, whoever wrote this, it was on regards dental implants. This wasn't some sort of a verbal attack towards general dentists or anything like that. I'm sure he's great at placing dental implants. He said that what a patient needs to understand here is that a specialist does not always mean good results or better experience. That is true. He says in 2 to 4 years of school training and residency, which is what he's talking about, which is full of unnecessary classes such as microbiome and histology. I wouldn't say microbiology and histology are necessary, but anyways, and old, not applicable literature. Hey, listen, when we were in lit reviews back in residency and we're reading 30 articles a week, trust me, I hated reading them. I did not, any resident is going to tell you that they hated lit reviews, okay? But if you would sit there and say that none of it's applicable, then that's a ridiculous statement, So he says a lucky resident may end up placing 100 to 200 implants versus a practicing GP who places at least 20 implants a month. Okay, so where are we getting our training, right? So if you're going to your residency and you're getting trained, whether it's implants or wisdom teeth or whatever it is, or all on fours, I highly, highly, highly recommend that if somebody's going to be learning, it not be out in the open field, but it be in a institution where you're being trained by people. Now, in regards to like as a periodontist, our surgical training, it's not about placing an implant. I've said in other videos before, placing an implant, dental implant, is like placing a screw in the wall, right? It doesn't take a genius, but understanding certain surgical baseline principles about how to manage flaps, about how to deal with dental implant complications, about dealing with like periodontitis, guided bone regeneration, certain things. I honestly, if I had to put my money on it and getting predictable results, again, I can't make a blanket statement for every single dentist or specialist out there, but I'll say that specialists are, for example, guided bone regeneration, your oral surgeon or your periodontist is going to be better well-versed at that. I mean, that's my personal take. With guided bone regeneration, what can happen is you can have dehiscence of your gum tissues, right? What happens when you have titanium mesh membrane exposure? How do you deal with some of these complications? These are certain cases that I feel that are better taken care of in the hands of a specialist, right? So, but again, like I said, I have friends that are dentists that place awesome implants and help train other other dentists too. So again, nothing but the most respect to you guys like that. He also says that he's saying so many treatment plans of patients complaining about the price with specialists. This will make an implant that costs $2,000 to $3,000 cost $5,000 instead. This is without the extraction and final restoration. And so, like, listen, that's a per case basis. Like, again, we can't make blanket statements that every oral surgeon or periodontist is going to treatment plan like that. So Now, in my personal take, one of the and we know with dental implant issues and failures, one of the biggest causes of periimplantitis is not having enough bone on the outer edge of your dental implant, whether a buccal or facial bone. Do we have the 2 millimeters of buccal bone so that your implant may be fine for 5 years before it starts to lose bone and to hiss on the facial, and then your gums start receding, and then you have periimplantitis, right? So can we manage that type of periimplantitis? In some cases, yes, but obviously any solution is going to be prevention versus trying to deal with these periimplantitis cases. So, Khalid, again, please don't take any offense. This isn't any attack on any general dentist or anything like that, but just some of these videos that we're talking about, and if you watch that video carefully, it's just certain things to look out for. Okay. Um, let's see. So after extraction of abscess 2, same day implant with bone graft should be placed or only bone graft to close the socket. I kind of talked about the same topic earlier. If you have an abscess, do not do an immediate implant on it. It's going to be more predictable to do a bone graft than do the dental implant. Not saying that it could never be done together, but if you want predictability, then you want to, socket preservation, bone graft it, let it heal. What kind of abscess are we talking about too? Is it a root canal failure? Because again, root canal failures, I mean, I would not place an immediate root implant in that site. Let's see. By the way, I did not put that implant on that patient. Yeah, yep, definitely did not. Let's see. What part of Texas are we in? We're in North Texas, Dallas Fort Worth area. We're offices in Plano, McKinney, and Grapevine. This patient talking about liver chin numbness. She's had numbness from September 3rd, 2021. Yeah, you need to go see who you had that procedure done with and maybe seek a second opinion. Hi, thanks for the interesting info. I am considering to get just one implant in the lower jaw for a premolar. Can I expect that this should be straightforward and is a good option considering the person doing the job has 15 years experience and the clinic appears well run? I could do a single partial denture to be safe as an alternative. A single partial denture is going to drive you nuts. So yeah, go ahead and get the dental implant. But I mean, I'm sure if this guy's been placing implants for 15 years, he's probably good at what he does. Again, look at his track record. Look at some cases. I'm not saying he has to be a specialist, right? But I mean, for me personally, like, obviously I'm biased, but I would probably go see a specialist. But again, I'm not making a blanket statement. I can't afford 20,000 plus and considering seeking treatment in a different country. This was a response in regards to gum disease. I see so many comments about, treatment in other countries. One thing I do have to say is like, listen, like, I have a buddy that got hair transplant surgery recently, like a month or 2 months ago. He had it done for real cheap in Turkey. I don't know how much it costs here. I know it was like he said like a few $1,000s there. Listen, a bagel's 5 cents in Turkey. Okay. It's not about like dentists in this country or plastic surgeons or veterinarians are out here to like rip everybody off. It's just currency exchange rates, right? Like I can't control currency exchange rates. So, we pay some of our like, our assistants like insane amount of money per hour, like which is probably what like 10x what they pay in Turkey also. So, our rent is a lot more expensive. Even in regards to some of our equipment, I had a lab guy. He owns a lab, and he told me that one of his milling machines was $30,000 less because he's a lab tech and not a dentist. It's literally the exact same machine, but they'll bring it to one convention, they'll sell it for $30,000 less because we're dentists. So there's so much manipulation in the game. I can promise you that we're not just trying to deliberately gouge you here. Okay. This is a currency exchange thing. And then the other thing I'll say is like these other countries, I mean, God forbid something happens here. I would hope that if the person has some sort of ethics or doesn't have ethics here and he's treating you and he doesn't give you a good result or a good job and he's not offering a refund or whatever, like some sort of compromise, then you have legal recourse here. You can sue, you can go to the dental board. The dental board's going to, work on your behalf. They don't give a damn about you over in these other countries, right? So they have no dental board, and you could sue them all you want. Nobody's going to help you out, right? So that's something else to consider, right? So, very helpful info. Do you do or explain? Could you explain suction dentures? That's all kinds of info I receive about grants and scams. My mouth hurts so bad. Um, you know, just I kind of talked about this earlier. If you're doing a regular denture, you know, after your extractions, your bone and gum are going to remodel for good God, I've been on mountain here for an hour and 25 minutes. I got to get off. So after all that remodeling, your bone and gum is going to shrink significantly. So what you want to do is you want to get a mold of your mouth to make a denture about like 5-6 months after you've had your extractions. That way you're going to get something that fits as well as possible. Again, try to avoid those cheap, super cheap, denture places, because they usually are just mills and they kind of don't care about the attention that you're getting. So that'd be my biggest piece of advice. All right, guys, I got to cut this off here because I have some other work to do and I need to get home to my kids here soon too. But let's see, any last quick questions? Yeah, Kel just send us the email. My dentist has told me I have gum disease. My gums are nice and pink, no bleeding, no bad breath, just a bit of tartar and deep pockets. I have a great smile. I'm scheduled for a deep cleaning. Live, laugh, love. If you have any doubts about it, go get a second opinion too. Dentistry is a very subjective. So not trying to call anybody out and say anybody's unethical or anything like that. But again, it's just subjective. So go get a second opinion. It doesn't hurt. At the same time too, like there's a lot of people who like love to, there's many different extremes. There's like some people who are like overly aggressive with their treatment, and you can go get a second opinion from someone else and they say like, oh no, that person's like, what are they talking about? You don't need that. And then I've seen also other people who are like so slow to treat, where I'm like, good God, well, like what are they doing? You should have been treated years ago, not months ago, right? So there's a bell-shaped distribution curve. Most dentists are going to be in the middle, and then you have your outliers, the people who are overly aggressive and the people who are just slow to react, and you have massive infections, and you're now in a lot of pain, and now you're upset at your dentist because why didn't they say anything about it earlier? Let's see. No, live, laugh, love. Get a second opinion. Is it customary to wear one mouth guard or two when sleeping after total mouth reconstruction with all on four? Yeah, just wear one night guard. Okay. Maybe I'll do this again. Like, it's got to be on a weekend. So I'll maybe I'll figure out a time eventually, maybe like next Saturday or the Saturday after or Sunday. And hopefully this will help people out. All right, guys, this was fun. And look forward to doing it again sometime soon. And I will set it up. I guess you could set up these things at a certain time and then just be prepared with the questions. All right. Thank you. Talk to you later. Bye.